Good morning, everyone. As Dave said earlier, I'm Tapestry member Paul Bonfanti, and I'm very honored to be speaking with you today about a topic very dear to my heart. In my day job, I'm the Director of Client Services for a nonprofit called Charitable Ventures, who was privileged to administer the Orange County Community Resilience Fund, a collaborative of funders that supplied millions of dollars to Orange County nonprofits for COVID-related relief. And I'm glad to use what we've learned to talk about nonprofits, specifically how they've been affected by the COVID-19 crisis. I have long believed that nonprofits are the best force for social justice and positive social change. Nonprofit scholar Bill Ryan, writing in the Harvard Business Review, also made this case, saying, nonprofits act as educators, advocates, and vigorous agents of social change, challenging society to respond to human problems in new ways. The idea for this talk started in May, and it was designed to be the story of how the nonprofit sector was resilient and adaptable and had come out of COVID-19 even stronger than before. And I really want to tell that story. But this crisis has gone on a lot longer than any of us thought. And the longer it goes, the more challenging it is for everyone, including our nonprofits. So while this ultimately is a story of creativity and creation, innovation and resilience in times of great challenge, there may be times where this talk is a bit of a downer. Let me start by talking about the impact of the pandemic on the nonprofit sector as a whole. The big picture: nonprofits are facing a trifecta of pressures: increased demand, increased costs, and decreased revenue. That's a rough combination. Fortunately, in many cases, they're finding ways to deal with it, and I'll talk about their response in a few minutes. But first, let's go into those three factors, starting with increased demand. To get to this, we have to talk about how COVID-19 has hit our communities. Everyone in the county, everyone in the country, probably everyone on the planet has been affected by COVID-19, but the effects aren't even. Both the economic and health effects have hit our most vulnerable members the hardest. We all know that seniors are more likely to suffer serious health outcomes from COVID-19. It's also well documented that African American and Hispanic residents are more likely to get COVID and to die from it. Similarly, it's true that the economic impacts of COVID-19 are more likely to be felt by our communities of color. And this is certainly the case in Orange County. In the county, unemployment is well over 10%. And while definitely some middle and high income people are losing their jobs, and it's undoubtedly traumatic for anyone to suffer that, the jobs that are hardest hit are retail, restaurants, hospitality, services, and the like. These are jobs that are more likely to be filled by women, by people of color, and by undocumented immigrants. Not coincidentally, these jobs also tend not to pay a lot. So when people in those jobs lose their job, they tend to have less savings, less assets to fall back on. The good news is that all levels of government did something about the problem. They provided resources to businesses and nonprofits through the Paycheck Protection Program and other initiatives, and they provided resources to individuals and families through stimulus checks and enhanced unemployment benefits. And these actually really helped, but they weren't a perfect solution. For one, the federal unemployment benefits and stimulus didn't go to the undocumented community, which makes up about 8% of our county's population. Those people just can't get help from the federal government. And even for people who did get help, it may not have been enough. This is where the nonprofit sector comes in. And it calls back to how I started, saying nonprofits are engines for social change and social justice. Most nonprofits, when a person comes into their office and says, I need help, I need services, they don't say, well, show me your papers first, or let me see your tax return to make sure you really need our help. No, they just help. And what we're seeing is a whole lot of people who never needed help before. There were a lot of people who were already struggling before the pandemic. But for others, they were doing okay. They were making things work. Now, all of a sudden, they lose their job, they run into other hardships, and now, all of a sudden, they need help. They need food banks, they need free health clinics, they need other services. And these folks, they don't necessarily know how to navigate the system. They're not used to needing help. They're in a completely new and scary situation. And county bureaucracy isn't always easiest to figure out. So they need our nonprofits to help them navigate the system. They need them to get them the support they need. One example of increased demand is food banks. So the second largest food bank, the two largest food banks in Orange County, Second Harvest and the Orange County Food Bank, have seen their numbers of meals served more than double. Some small food banks have had their numbers increased by 20 to 40 times. One government leader described this as modest providers becoming superstars overnight. Collectively, at the peak of this crisis, the food bank system was serving at least 1 million meals a week, which is unprecedented and gives you an idea of how much extra demand our nonprofits are facing. Let's talk about the second pressure, and that is increased costs. So of course, with increased demand, there's an increase in costs for supply, staff, and the like, but it goes deeper than that. Any nonprofit that's still seeing clients, they needed to buy personal protective equipment. They needed to get those other safety features you see, and they certainly hadn't budgeted for that. This is really acute for a free healthcare clinic that's seeing patients that may have COVID. Also, so many nonprofits rely on donations of items and of volunteers. And when COVID hit, a lot of those volunteers self-isolated and stopped coming. And a lot of donors realized they needed the things they were donating, or maybe they were worried about dropping them off safely. So volunteers stopped coming, items stopped coming, and nonprofits did what they had to do. They paid their staff more to fill those roles. They bought things they couldn't get donated. Extra costs. Organizations that moved to remote service delivery suddenly had to pay for training, for technology, for things to deliver the services and to adapt. So there's the increased costs. Then we've got the third pressure, which makes the other two more challenging, and that's declining revenue. Every major revenue source shrunk for nonprofits. Individual donations declined as people became worried about their own livelihoods or saw their investments shrink and were less likely or able to donate. And fundraisers got canceled en masse, because how are you going to do a major gala when you can't get 300 people involved? Some foundations and government agencies told their nonprofits they would have to delay their grants. On the positive side, there were over $10 million of emergency grants, such as the Orange County Resilience Fund I mentioned earlier, made available to nonprofits, which have been a big help in keeping our nonprofits alive. On the other hand, government contracts have been a major problem. As you've probably heard, state and local governments are in big trouble with their budgets. And while they don't want to, they're looking to cut contracts when they can, which means fewer services for the people who need it. And then there's fee-for-service income like admissions, tickets, program fees, which is a much bigger source of nonprofit revenue than you may expect. And that has dried up dramatically. Any cultural institution that charged admission or sold tickets has seen that money all but disappear. Organizations that run service programs like daycare, educational classes, camps, programming, alike, done. And places that provided services on a sliding scale have seen a lot more people pay less on the sliding scale or nothing. So there's our trifecta: increased demand, increased costs, and decreased revenue. I did warn that there'd be some down notes. But here's where the story of creation, creativity, and adaptation comes in, and how our nonprofits are responding. So first of all, the spirit and the attitude of individual nonprofits, their leadership, their staff, their board, is truly inspiring. And these past 5 months have made me even prouder to be a part of this sector. It would have been so easy to look at this litany of problems I just talked about with despair. But that's not what's happening. I remember one conversation with an executive director of a health provider who just said, "We have to use this opportunity to get better." She didn't worry. She used it as an opportunity to figure out how we get better. The large majority of organizations, they rolled up their sleeves and they figured out a plan. They rallied around their constituencies. They collaborated with other organizations. They talked to their funders, came up with creative solutions, and they implemented them. And in many places, these solutions are things that no one would have even thought about in 2019. So Tapestry is a great example of this. 6 months ago, would you have ever thought that we had 80 to 100 people coming together every single Sunday to watch services on a computer? That would be crazy. But thanks to the leadership by our staff and tireless work from our volunteers, we found a way to engage people in a different but still effective fashion. This has been the story all over the sector. Organizations have been using technology in new and exciting ways. Telehealth is another one of those terms that a lot of people hadn't even heard of 6 months ago, but now it's widespread. Classes, performances, support meetings, social gathering, virtual visits, delivering these online is commonplace now for nonprofits, many of which had never even heard of Zoom in February. Now, I'm not going to say this is a perfect solution. There is nothing like face-to-face contact, and the digital divide is still a very real thing. So for some of our vulnerable communities, digital services may not be easily available. But in some ways, there are advantages to virtual service delivery compared to live service delivery. For some people, there may be a stigma to go into a nonprofit's office for help. They don't want to say face-to-face to someone, "Hi, I need help." For a lot of people, particularly in our vulnerable communities, transportation, childcare are real obstacles that stand in the way of them going somewhere to get services. It may be difficult for them to get to their local family resource center or their community clinic to make their appointment. Now, they can do that over the phone or online. For some undocumented individuals, mixed status families, they always live in fear of getting on the grid, of getting picked up by the authorities because they went out of the house. So they don't go get our services. Now it's a little safer for them. They can get what they need from the safety of their own home. And what's exciting about all this is now nonprofits have learned how to deliver these services. They didn't know they needed them 6 months ago. They've learned how to do it. Clients have learned how to access it. They've seen that this can work. So there's a lot of optimism now that this pandemic will actually teach us all how to better serve our communities, how to better deliver services, and how services can be more available. Well, what about services that can't be delivered online? Like you can't deliver a bag of food online. Material needs need to be delivered in person. Well, food banks, senior centers, other nonprofits, they've taken a page for the for-profit world from this. Do you know how you can use Grubhub to deliver food, or you have contactless pickup at your favorite restaurant? Well, nonprofits are doing that now. So Meals on Wheels has always been a wonderful program that people know about it. Senior serving organizations have built on that model. Other organizations have built on that model to deliver healthy food to vulnerable older adults and other people. Food and diaper banks have set up safe ways for families to get supplies they need, like drive-through pickup centers. Homeless shelters, other shelters, they don't lend themselves to social distancing, but they've been very innovative. They found ways to renovate, expand, use extra hotel capacity, creating safety measures in a way that still serves their residents and also still recognizes their fundamental dignity. Our nonprofits are learning how to do all of this in a way that's more effective and more efficient, which again will help in the long run. And let's talk about revenue. I mentioned earlier that organizations have had to cancel their fundraising events like galas. Let me tell you my opinion on galas. It's maybe a little controversial, but there are other people who believe it. They're kind of dumb. Nonprofits feel like they need to have them. They spend so much work and money on holding them, but they don't net anywhere near as much as they think they do. So instead, nonprofits are holding virtual fundraisers. Somebody mentioned in the chat today that they'd just gone to a virtual fundraiser. Or they're going to their big donors and saying, "Hey, you know that money that you would have donated to your to our gala? Can you just give it to us directly instead?" It doesn't always work, but it's working enough that they're getting revenue and they're saving a lot of time. Other organizations are creating new solutions, like our online auction that Dave mentioned earlier. That is something that's being done by organizations across, using online as a way to earn money. There is such a positive spirit of innovation, of creation, and our nonprofit community is working so hard to continue to be successful and to serve our most vulnerable residents. And again, it's inspiring and exciting to me. But let me go back to something I said earlier at the beginning. We don't know how long this pandemic is going to last. And every month that goes on, it gets a little harder for our nonprofits and for our communities. Reserves and resources are dwindling. Stress and worry is growing. One leader of a domestic violence shelter told us last month, it's getting to be a real concern because our resources are depleting and we're worried how we're going to keep serving the needs of our population. She wants to, she needs to, but she's looking at her balance sheet. She's worried, how is she going to do this? So what can we all do about this? How can we help our nonprofits support our communities? Well, I'm sure there are people here who work for a nonprofit. And the first thing I would say to them is keep your spirits up. Stay positive and know that there are so many people out there who rely on you and so many people out there who see the work you do and applaud it and want to support it as best as we can. Keep on creating, keep on working across organizational lines to help the people in our community who need it. But most of us don't work for a nonprofit, and we can do a lot. So I'm an optimist by nature, and I still believe in the power of the people and democracy. I mentioned earlier that the stimulus and the Paycheck Protection Program have done a lot to reduce the crisis our community members have faced. In fact, in Tapestry, we received paycheck protection money, and that money has, if you excuse the term, been a godsend to us. But that money's over now. The more we can do to advocate for more support for our nonprofits from the local, state, and federal level, the better our nonprofits and our communities will be. And at every level, budget cuts that affect our communities and the nonprofits we serve are coming. We have to use our voices to make sure that the programs that we are passionate about and that help the people who need it the most don't go away. So use your voice, write those letters, write those postcards, keep advocating, make phone calls. But the biggest thing we can do, even bigger than that, is see if we can support our own nonprofits directly. There's a saying that goes a little bit like, what you spend your time and money on shows what you value the most. And there's an opportunity here for us. I know that many of us in Tapestry and many people in the county don't exactly have discretionary time or income right now. But if you do, nonprofits need your volunteer time and they need your financial support. So I urge you to learn about the nonprofits in the causes you care about most. Giving and volunteering helps so much. And also, just like some of us may have bought gift cards to keep our favorite stores or restaurants afloat, maybe there's a creative way like that you can support your nonprofit. Talk to them, find out what they're doing. And while every organization needs support, before you give, maybe dive a little deeper into their needs and finances. The bigger nonprofits that have been around for years and have the big footprints and have big reserves, they're probably going to get through this. The smaller ones, the ones that serve marginalized, the ones that serve vulnerable populations, maybe don't have as much of a track record, maybe don't have the deep reserves, those are the ones that are going to struggle and could use a little bit more support. So I hope that's a hopeful note to end on, and I hope this talk wasn't too much of a downer. Again, I'm an optimist, and I believe that our nonprofits will get through this. They are going to change. They're going to face some challenges. They're going to face difficult decisions. But the spirit and passion around helping people and helping communities, of being of service, is so strong. And that, with a little help from us all, is what's going to keep these engines of social change going. Thank you.